Hi everyone, we are group 1 and we covered over-the-counter medications for dermatitis. So what is dermatitis? Dermatitis is inflammation and irritation of the skin that can manifest in a variety of ways. We have atopic dermatitis. This is linked to allergies, contact dermatitis, which is direct contact with irritants, and last type of dermatitis, it can cause dandruff and scaly patches. Some symptoms include redness, itching, dryness, swelling, blisters, and non-medications to treat the condition can include avoiding triggers such as soaps or detergents, moisturizers, wet wrap therapy, such as using a topical agent that's covered by an initial wet layer of gauze or bandage. And then lastly, baths such as oatmeal baths or antiseptic baths, where you take a quarter cup of bleach and add it to a full tub of water, and this can help clear the skin of microbes. So this is just a insert from the Journal of American Academy of Dermatology that kind of just takes you through different treatment pathways.
The first drug we'll cover is hydrocortisone cream. It is a low potency topical corticosteroid that works primarily by reducing inflammation and suppressing the immune response in the skin. It's used topically. It relieves itching, redness, swelling, rashes, and reduces inflammation. Adverse effects include redness, dryness, and itching, and it is a category C medication with unknown effects to women and the fetus, pregnant women.
So for our over-the-counter antihistamines, we have diphenhydramine, which is in tablet or cream form, mostly used for itching and the antihistamine effect. It can cause drowsiness, dry mouth, dizziness, and confusion, and that's why it should be used with caution in the elderly due to sedation effects. Then we have latardidine, which is Claritin, and that is available in tablet and liquid form as well. It's non-drowsy, and it's used for the itching relief effect. It does cause headache and dry mouth, and it's generally safe for children over 2 and should be consulted with your healthcare provider for pregnancy. Then last but not least, we have cetirizine, which is also a tablet or liquid, reduces itching, can cause mild sedation, so drowsiness may occur, dry mouth and fatigue, and we should be using that cautiously in the elderly as well. Next slide. For analgesics, we have acetaminophen, which is a mild pain relief and fever reducer. The main event here is watching for liver damage and also severe reactions such as Steven Johnson's rash. Special populations, renal and liver function should be evaluated, especially in the elderly. And we should be mindful when we're dosing children based on their weight and limiting prescriptions and over-the-counter use to one product that uses acetaminophen. Salicylic acid comes in multiple forms, cream and liquid, and that's used to desquaminate the skin's topical skin area and reduces inflammation. Adverse events could be burning, dryness, and stinging of the skin, and it has been shown to be in oral form to be harmful to the fetus, so caution should be used in pregnancy and also with children as it's a salicylate for Ray's syndrome. And last, we have capsaicin, which is a topical ointment, and that relieves pain and itching and by blocking nerve signals. And adverse events could be a little burning, skin irritation, and it also has been shown to increase blood pressure by about 10 points. So that's something to be mindful of as well. Next slide.
So you also have antifungals to treat dermatitis. The first one is ketoconazole, and that is mostly used for lots of different types of fungal skin infections and also seborrheic dermatitis specifically, or even dandruff. And so you're just watching out for application site reactions like irritation, pruritus, stinging, and dry skin. And just to note, this is a CYP3A inhibitor. It comes in different forms like cream, shampoo, foam, and gel. And just watching out for the breastfeeding mothers and applying or avoiding to apply on the nipple and areola area. And in neonates with the large amount of propylene glycol, which is a product commonly found in ketoconazole products, it is found to be associated with metabolic acidosis, seizures, renal failure, and CNS depression. And then we have zinc pyrithione, and this one also helps to treat seborrheic dermatitis, dandruff, and other fungal skin infections. Just watching out for new and worsening dermatitis symptoms like increasing swelling and redness and itchiness. Comes in liquid shampoo and bar. And this is not an FDA approved product, so you do want to be cautious using it in all the vulnerable patient populations such as geriatrics and pediatrics. And then we have selenium disulfide. This one also helps with seborrheic dermatitis, dandruff, also watching for application site infections, but also alopecia and hair discoloration. It comes in lotion and shampoo. This is also a category C product. Next slide.
So here we have keratoplastic and keratolytic medications. We've already talked about salicylic acid, but I'll bring up coal tar, which is, works by suppressing the DNA synthesis and subsequent inhibition of keratinocytes, which are the protein that make up the epithelial layer of your skin. It is found in shampoos, creams, lotions, bath oil, and ointment. It leaves itching, redness, dryness, flaking, and can be applied 1 to 4 times daily. And some adverse effects would be scalp irritation, new onset, of course, standing of the hair, specifically blonde hair, tar acne, allergic reaction, photosensitivity, and folliculitis. Contraindication is used in pregnant women, although there's not enough evidence to rule out fetal risk. Those using UV radiation treatment for psoriasis due to the photosensitivity effects. And then anybody allergic to lanolin, mineral oils, or other emulsifiers, because those are commonly found in coal tar products. And then anyone with an active flare-up. Next slide.
For medication safety issues, the first one is there's always a risk of these topical corticosteroids being absorbed through the skin and potentially reaching the systemic circulation. So you see things like insulin resistance, adrenal suppression, hence there's a risk for increased development of diabetes. And so this is found to be associated with all levels of potency of the hydrocortisone cream, which is an example of mild potency corticosteroid for topical use. And then you have tinea incognito. This is a skin infection, a fungal skin infection that has very similar appearance to eczema and psoriasis. And so people commonly mistreat it with topical corticosteroids like the hydrocortisone. And then this initially helps to improve inflammation, but the fungal infection never gets treated. And so it just keeps worsening. And when it changes in appearance because of the hydrocortisone cream, it ends up looking like a different skin infection, hence its name tinea incognito, a fungal skin infection that's hiding. And then always just watching out for the breastfeeding mothers, making sure that the mothers are educated to use the smallest amount of hydrocortisone cream on the smallest area for the shortest duration and cleaning the skin before they breastfeed.
Of course, you want to watch out for salicylic acid toxicity, of course, due to skin absorption, and this specifically would affect children. And you want to watch out for the fetal damage in pregnant women and for the risk of Raynaud's syndrome in children with viral illness. And then for any of these over-the-counter medications, we have drug-drug interactions, watching out for skin breakdown, testing on small areas, and watching out for negative interactions with other over-the-counter medicated creams, but also non-medicated creams and cosmetics. Next slide.
I'm going to take a minute to just describe some of the prescription options that we have available for treatment of dermatitis. The JAK inhibitors and the biologics are both used. They both work in reducing the inflammatory response by binding to cell receptors to disable the pathways. The JAK inhibitors are available in cream and tablet form, and they are the new player on the scene. The dermatology community is very excited at the factor they may play in improving the quality of life for patients. The administration is simpler, but it's not normally used in pediatric populations. As you can see, we listed those on the slide right there. The biologics are available as injections. They are given every 2 weeks. An example is the dupilumab. They can be done at home. They are long-term treatments, and patients need to be committed to being consistent. If they were to stop using it because they see an improvement, eczema will flare and they will have to start the cycle all over again. The immunosuppressants are also listed below, and they are usually used as a last resort, particularly in the pediatric and elderly populations for many of the safety reasons that we discussed earlier in the presentation. They would be prescribed as a short course therapy, and long-term use is avoided. Finally, the topical treatments, hydrocortisone is the mainstay option. It is available both over-the-counter and prescription. The over-the-counter is usually 1%, and prescription begins about 2.5%. We touched on the method of action earlier for these, but as a reminder, their main job is to stabilize cell membranes, to release the amount of substances released that cause the inflammation that lead to the goal of reduction of inflammation and controlling itching. Aside from the hydrocortisone, one of the most commonly prescribed is triamcinolone, and then we also highlighted the lowest and highest potency steroids. The other topicals include TCIs. They are calcineurin inhibitors. They block calcineurin, which is involved in activating the T cells. When this pathway is inhibited, inflammatory response is reduced, and this can also help with inflammation and itching. One big advantage of these is that they can be used for longer periods of time as they are non-steroidal, and they can also be used on the face. The PDE4 inhibitors, Eucrisa, is very oftenly prescribed, and they inhibit PDE4, which also helps regulate the inflammatory response, which allows for a better regulation of what can often be an overactive immune system response. Next slide, please.
All right, we're going to quickly review the cost for each of these medications. For your hydrocortisone cream, we'll apply thin layers to the affected area no more than 3 to 4 times per day, 1 to 2 weeks. And for a 1 ounce tube, that's $4.19. For Benadryl, that's a 25 milligram tablet every 4 to 6 hours, no more than 6 doses in 24 hours. And for a 100 count bottle, that's $4.13. For Tylenol, it's a 500 milligram tablet every 6 hours while your symptoms last, no more than 6 tablets in 24 hours, and a 500 count bottle for $9.90. Next slide. And then for our 3 shampoos, dosing is about a quarter size, depending on length and thickness of hair, applied to wet hair, massage into scalp, rinsed. For zinc paraffin shampoo, it's at least 2 times a week, 4 to 6 weeks. And for an 11-ounce bottle, that's $5.02. For ketoconazole, that's 3 to 4 times a week, up to 8 weeks, 7 ounces for $15.88. And then lastly, coal tar shampoo, at least 2 times a week for 4 to 6 weeks. And for a 6-ounce bottle, that is $7.19. And there are approximately 12 drugs that treat dermatitis. Thank you for reviewing our session. If you have any questions on our references, they're provided here. Have a great day.